Coronavirus testing has been top of the news agenda for a few weeks now. Many people critical of what they see as a lack of testing, not least those NHS workers who don't know whether they should go back in or not. The void is being filled by some offering private testing. Dr. Grant Charlesworth-Jones is Medical Director of Summerfield Healthcare, which operates private health clinics based in the West Midlands, who are charging, is it right, £249 a kit?
Yes, good morning, Emma. If you look at the website, so the summerfieldhealthcare.co.uk website is selling these at £249. And if you actually do look at that website, there is actually now an NHS offer which we've been able to mobilise. It's taken a bit of the resources of the IT system here because we're flat out. But we've actually now, if you look on the website, you'll find there is an NH Staff Click Here button, which is offering it now at £199.
That's not cheap,
so there's
is it?
news for you.
That's not cheap, though, is it?
It simply reflects the cost of what the cost test to actually conduct, because it's not a simple test.
How much does it cost to conduct? So what's your profit margin?
Well, at £199 there is no profit.
So £199 is what it costs to conduct a test.
Yeah. So you've got the cost of don't forget you've got the cost of the lab test. You've got the cost of the medical kit. You've got the cost of the couriers. You've got the cost of the administration. And can I just point out here that we at Summerfield Healthcare, we're not in the business of selling tests. We are actually a Care Quality Commission regulated and registered company, and we provide a care service to our patients. It's a little bit frustrating that 90% of our work is in looking after our patients,
yes,
and 10% is the coronavirus, and yet that gets 90% of the attention. But
well, you're on because it's interesting for us to hear about this market now for private tests, and people are taking you up on it. And you can argue, of course, that it's part of their healthcare, that they can find out if they've had it, if they've got immunity, and that also could be helpful to them in their line of work. But of course, I'm sure, will be aware of the criticism that there has been of those who are profiteering from a crisis.
Are you referring to somebody in particular?
There has been a particular individual. I'm not talking about him and all the specifics now, but that the concept of charging for tests right now is not something that's sitting easy when not everyone who really needs a test, namely all NHS workers, can get them.
Okay, so to answer your question, we're basically giving people choices, and what the actual origin of that choice is a matter for them. But in actual fact, if they've got a choice, so we basically help people, we provide care, and we love providing care for people. And if they've been turned away by the NHS because of an access or a provision service, people can come to us. So we're by no means detracting from what the NHS do. And if you think about it, if one person comes to us for testing, that's one person less who's looking to the NHS to provide that service.
Do you think it's right to offer these tests overall? Nothing to do with the money now. Public Health England says, and I quote, use of these products is not advised. There's little information on the accuracy of these tests or on how a patient's antibody response develops or changes during the COVID-19 infection. It's not known whether either a positive or a negative result is reliable. Currently, there's no published evidence about the suitability of these tests of diagnosing COVID-19 infection in a community setting. What's your response to that?
COVID-19 has developed so rapidly that you have to bear in mind that the laboratories responded so equally promptly, but at the same time to get the actual data that will give us the absolute results about reliability, we're talking about hundreds of thousands or millions of sets of data over years and years, where we can say, like for example, testing for HIV, that went through the same process. I don't have a difficulty with people. So, for example, if you had an HIV test and it was positive, you would in no way discredit that test just because you went out and paid for it. And just like having a positive result, it would then inform your behaviour thereafter. And it's not the same as COVID-19 in terms of the infection organism and things like that. But the process of getting, if somebody could even argue that there's an element of social responsibility. That actual fact, if you can afford it, and I would highlight that unlike that doctor that you alluded to before, who was basically charging what people were prepared to pay.
Yes.
Our stance is that actually, what can these kits reasonably be sold for? So if people want to have that, discharge their social responsibility through self-testing and actually know, because there are some surprise results out there, and we know that the NHS certainly isn't testing people with mild symptoms, but mild symptoms don't mean to say that you're not infectious and can go on and cause a co-worker or a family member or friend an infection which leads to very serious symptoms.
Have you had it?
On their health state.
Have you taken the test?
Yes, I did the test simply because we want to know exactly what the patient journey is, so that when we're explaining to people, this is what happens, this is what to look for, this is the pros and the pitfalls.
You wanted the experience of it. No, I totally get that. But have you had it? Have you had COVID?
No, I haven't had COVID.
No.
No, I haven't had COVID, but what we're doing at the moment, and this is all part of the added value from the holistic point of view, because you've got to bear in mind, we've been around for half a decade, quietly at first, but people would find us if they were looking for us. And but I mean, all part of the holistic element of this is we're calling people back who tested positive. You test positive, but you get the same day as the lab gets the result. We've got people working till late at night waiting for results to come back, so we're actually reaching out to people. But then we're also putting these people on a callback list, so that a week or so later, we're just reaching out to them and just saying, it's a really difficult time, and we're not trying to sell you anything here. We're just saying, what was the experience like? Do you have any recommendations for other people going through this, so that we can help to spread how you coped with it and what worked for you and things like that? So it's more than you're not just paying for a test and a result. You're paying for a whole service of care.
Would you ever give it for free?
I think my company would be bust if I gave it for free. I mean, I personally could not afford to subsidise, these tests. And I don't.
Where are they made, out of interest? Where do you get them from?
So we only use UK labs, which are UKAS accredited. Right. I understand that some of the component parts from the assays for the machines, and bearing in mind these machines are taking DNA to pieces and looking at very specifically at the bit which will be affected by COVID-19. So I understand that some of these component parts come from America.
Right.
But
okay. I'm just trying to understand how many tests there are, I suppose, out there, and how many. I mean, how many have you got in your possession?
So we keep a stock of between 500 and 1,000. I will say that the corporate bodies have really woken up to this and realised that, actual fact, if you've got a member of staff who've been self-isolating and they're returning to the work environment, you don't actually know that they're clear of the active virus. So in actual fact, they may have self-isolated. Don't forget, some people may have self-isolated for the wrong reasons. They might have, for a set of symptoms that was nothing to do with COVID-19. But there was some similar overlap with symptoms. So what they don't want to do, and we're working really closely with organisations like the Road Haulage Association and supply chains, because if that infected individual goes back into a workplace such as a warehouse or something, you're then going to have a lot of further people developing symptoms, self-isolating. This is going to lead to massive supply chain disruptions, and knowing the status of your workforce and the viability, and making sure that we have a triage system so that people from high-risk travel groups. There's a lot of lorry drivers have returned from mainland Europe, and they haven't been tested. I can tell you now, I know of people who've flown back from West Africa, from the Gambia, earlier on this week, and they've not been tested.
Well, no, the list probably is endless to some degree. I suppose we've just got a text in saying, is it morally right to charge NHS workers at all, even if you don't get a profit? What would you say to that?
I think it's impossible to put it on one individual in a private company. And bearing in mind, I'm not a multi-billionaire or anything like that. It's impossible to put it on one person. If I have had Bill Gates' money, absolutely, you wouldn't even notice this money going out of the bank. I'm afraid.
It says, just to quote you back though, you did say it says only a small part of your business. So I suppose it's just about if you could afford to do that, and it wasn't a big part of your business before. That's the rationale, I presume.
Would you? The thing is that would you then have to start subsidising it from other parts of the business? I mean, if you look at our business, our cost to see for a private GP appointment for 15 minutes, bearing in mind that NHS is 10 minutes, is £59, and it's been fixed at that for 4 years. And I can tell you now, Emma, that £59 exactly at the time what it cost to fill a VW Golf with a tank of diesel. Okay. And I figured if people can afford that, and there are a lot of VW Golfs on the road, I can make healthcare accessible for them.
Thank you very much for coming on to talk to us. Hope you keep well. Dr. Grant Charlesworth-Jones there, the Medical Director of Summerfield Healthcare.